another one of our outstanding therapists. David did his orthopedic residency in physical therapy at Johns Hopkins, and now is one of our senior therapists, and works very closely with our performing arts program, both at our Timonium location, but also down at the Peabody Conservatory. So we're really excited to have David as a part of our team as a former professional figure skater himself. He knows and understands what it takes to perform, and he's just done a great addition to our team in terms of helping support the growth of our specialty programs, but also as one of our rising leaders. So I will turn things over to David.
Hi, everyone. Thank you for joining us today. Let me just share my screen here. So the patient that I have today, I'll preface it that it's not a performing arts patient, but it does reflect one of the ways that I found Winback to be particularly helpful. I've been using Winback since the beginning of 2020. So I had about a month before the pandemic began and then got a refresher on it when our clinics began to open. And I think one of the things that I've appreciated about it the most is how it's able to do something that we can't do without it. In this case, just the fact that we're able to use this current to help to stimulate a process that the body is trying to do anyways, to heal itself faster. So one of the things that I've experimented with it is using it post-op for patients. So the patient that I'm sharing with you today is someone who had a discectomy and then a laminoforaminotomy. That is a mouthful. And so I was seeing them about 3.5 weeks post-op. Just a little bit of a background with them. They were 41 years old. And 2 months prior, they had woken up with heaviness in the glutes that radiated to the feet. And it was a pretty quick progression to just experiencing pain and tingling, and even weakness that was beginning to occur in the lower extremities. So they just kind of had really great luck and were in surgery 10 days later, which I feel like is rare to get through the medical system that fast. And so I was seeing them about 3.5 weeks post-op. So they were having a pretty, I'd say, uneventful experience so far after that, which was good. Their myotomes and dermatomes were intact. They were experiencing some weakness with great toe extension, as well as some tingling they were still experiencing in the foot and the calf region as well, but all kind of to be expected for less than a month after surgery. They were just like pretty guarded in general as far as like with sitting down, standing up, they were using their hands, they were moving slow, they were walking slow, just kind of scary to experience something that they hadn't before that had progressed so fast. Let's see. So this says day 2, but some of this was day 1 as well. So the initial thing that I kind of wanted to work on with them was just to get them more comfortable. So similar to Ryan, I think I feel like Winback and other modalities are things that I'm kind of thinking of like day 2. Day 1, I kind of just want to get them set up with stuff that they're able to do at home and just begin to move in a way that's going to be more normal, to get them into a normalized movement patterns as quick as possible, just since that's what they're going to be able to practice the most in between our sessions. So we worked on just transfers, getting them comfortable with that, not needing to use their hands, hinging at the hips to kind of understand what movements were safe for the back so early on in surgery. exercises that are part of the original strength system, which is essentially just back to basics, pediatric progression, but through a reset strengthening model, and starting them off with some lumbar stabilization intervention. So teaching them how to activate their transverse abdominis and how to keep that engaged while doing a heel slide or a bent knee fallout, which you'll see in some of the videos ahead. So some of those were started day one. We followed up with those day two. Where I wanted to begin to bring the Winback in was just thinking that the body is kind of trying to recover from this surgery. I just feel that like with the Winback, we're able to augment that by having this current that is going to just be moving through the area, depolarizing cells, and just allowing waste products to get out, nutrients to get in to just help facilitate this as quick as possible. So because the body is already trying to heal itself, I'm going to keep the heat a bit lower for that. So I was using RET at 20% just for 5 minutes. I feel like in this case, it's more just this supplement that I don't need to do a ton with it, but I do just want to create some facilitation to try to see if we can augment what the body's already trying to do. So we did that. And the initial results with this, after having pretty much done progressing through those exercises, but sticking with this treatment with the Winback for 3 visits, the patient was reporting improved stamina. They were experiencing less tingling in the feet and in the legs, and an overall change in quality of pain from not even so much tingling anymore, but just more of a dullness they were reporting. So since their symptoms were getting better, since they were moving a lot better when it came to transfers, I now kind of wanted to get into what does their strength look like. So they had a pretty significant strength difference with hip extension. This was measured with handheld dynamometry, and these were averages for 3 measurements. So he had strength of 25 pounds on the right side, which was the side that he was experiencing more of the symptoms with, and 57.1 pounds on the left side. So where my mind went again was to begin to try to use the Winback to try to help these muscles and the fascia just get into a better state where they're going to be able to create better force production. My thought is I'm going to be doing strength exercise anyways. Let's try to have this current move through the area where it can be depolarizing these cells in between where I have the ground plate and where I have the bracer, as you'll see, to just try to help them function better and to possibly strengthen quicker as well. So I have a picture to the left where you can just see that I use the adhesive pad on the low back area with the connector that would connect to the machine. And then I was putting the bracer around the foot in the same spot that Brian's patient had theirs as well, as we were taking them through some exercises. So you'll see here, I have it on RET, 30% low pulse. And so the sticker is on that adhesive there, and then you can see the bracer around the foot there. Just allowing that current to be running pretty much through the leg and up to the back area through the muscles that I'm trying to strengthen there. So you can see that we did the bridges with an isometric hold with some hip abduction activation there. And then just went through all the regular exercises we would do for this. So we went into single leg bridges, as you can see there. The settings for all of these are the same, as you'll see there. And then we're going to go on to using the, what he has there is a biofeedback pressure device to make sure that he's activating to the correct level as he's performing a heel slide there. And then if we go on, you will see same biofeedback device there, but now using a bent knee fallout with it as well. And then lastly, trying to move into more of standing activity. I use the bracer, but you could also use the ground plate here too. We were doing moving more into like a loading position for the leg there, for the glute and the hamstrings. So we did this, I want to say we were about 1 time a week then. So I want to say 2-3 weeks. And the results were pretty impressive. So his left side was measuring 54.9 pounds. His right side had jumped up to 52.6. I know with handheld dynamometry, they're definitely, it plays into a little bit of how much you're pushing as well. But regardless, even if there's some variability with how accurate there was definitely a huge change in how much force he was giving me there with that. As well, he was reporting stiffness in the low back and a low level sensation under the first MTP joint on both sides that he was kind of describing as just like stepping on a pebble. But there was no tingling that was present anymore with that. I also want to acknowledge too that some of these results that we would be seeing, it's expected that some of it is the natural healing process with it. But I will say, I've also treated someone post-op ACL using this early on the same way, trying to use like low levels of heat and more so the properties of the current early on, and then bring in the Winback this way for more of the exercise. And I've gotten really impressive results with it as far as just minimal symptoms. I'd say really minimal, just variability in the progression of the healing. It seems to be going more linear versus kind of up and down. So I'm very happy with how it's working post-op for these patients.